Thank you. Okay, good morning, everybody. Thank you for being in our headquarters, our fire department's headquarters, for what we think is a very important topic, of course. We're here to give a progress report on our Health 99 overdose response unit, showing how the city is advancing an innovative, health-first approach to the deadly opioid and synthetic drug crisis. I think many of you are following this work, and because of how we do this work, sometimes ride-alongs are not appropriate, and so we thought it very appropriate to give you an update in light of what's happening in our city. We all know that fentanyl and synthetic drugs are a scourge on our city. We don't have to go far to see the effects of what's happening out there. It's killing people who are using them and creating unsafe and unwelcoming conditions for all Seattle residents. We know that our Seattle Fire Department, EMTs, and paramedics are responding to approximately 103 suspected overdose and related emergency calls per week throughout the city. That's a critical number. This is why part of my executive order that I issued in April called for building an evidence-based public health approach to support people struggling with addiction to these dangerous and highly addictive substances. Now, Health 99, as we've called it, is a critical component of this health-first approach. It charts a new course for following up with overdose survivors to make referrals and handoffs to life-saving treatment. Now, by dispatching the Health 99 unit to overdose calls, dedicated caseworkers can quickly engage with an overdose survivor and provide compassionate outreach and referrals to support. And we're hopeful that this unit will play a critical role in creating a supportive ecosystem where people experiencing addiction can access treatment to help them recover and live healthier, optimizing lives. I've been clear in how the city has been going about this kind of work, a dual approach. Leading with treatment, leading with treatment from those suffering from substance use disorder, and focusing our law enforcement resources on the narcotics traffickers who are bringing these deadly substances into our communities. Now, we are acting with urgency to build out a bold, health-first approach to help those in need and to curtail the impacts of public drug consumption and hold dealers and traffickers accountable. We've been making progress to interrupt the flow of narcotics into the city, and with our federal partners working collaboratively with them, our police department, and some of you heard me talk about this recently, we've seized over 2 million fentanyl pills so far this year. Surveys have demonstrated that 80% of opioid users say they want to stop. They want to reduce their drug use. But too often we do know that care is either not available or too high of a barrier for them to access. So in July we did announce a spending plan for $27 million investing in enhanced treatment facilities and new addiction services and an improved overdose response. We continue to make progress on these actions laid out in my executive order, including launching an innovative contingency management system, management program with Plymouth Housing that will kick off next month. And as this work continues on a post-overdose diversion facility, you also heard us announce our increased mobile opioid medication delivery and expanded naloxone in the city's highest overdose locations. So our North Star continues to be saving lives and helping people access the treatment they deserve and to work to build a safer and a healthier Seattle. And that's what all of our strategies working together are intended to create. Next, you're going to hear from Councilmember Lisa Herbold, who, as many of you know, chairs our Public Safety Committee, has been working in politics one way or the other for decades, and who's an outstanding and compassionate leader in our city about what she cares about. And we'd love to hear some words from Councilmember Lisa Harrell.
Good afternoon. The creation by Mayor Harrell and Chief Scoggins of Health 99 continues Seattle's reputation as a national leader in health initiatives to address the opioid crisis, a crisis that's faced by cities all across the nation. Follow-up care and warm handoffs to services are essential to reduce the likelihood that an overdose is repeated. Accessible emergency care wrapped in inclusive and supportive services help more people center and enter addiction recovery. Public health and public safety are intertwined issues. The fire department is doing this work to build a healthier and safer Seattle. To support the urgent funding for one element of Mayor Harrell's April executive order, specifically access to mobile on opioid medication delivery, last month I championed $1 million in funding to support Treatment in Motion, which is a mobile medication vehicle that will be available at 3 additional locations with the capacity to serve up to 360 people each day. Next week, I'll be hearing legislation in my Public Safety and Human Services Committee to appropriate $7 million in support of Mayor Harrell's $27 million investment announced in his April executive order. These funds will be used to support an overdose recovery center, so Health 99 has a location to take people after non-fatal overdoses so that they can recover, get stabilized on medications, and access resources. One of the things I hear most from the fire department is when they successfully reverse an overdose of somebody who is living unsheltered, they save their lives and then they move on and leave that individual on the street. There's no place to take those folks. The Overdose Recovery Center, which we'll be working on again next week, will respond to that call that we're hearing from firefighters. A data finding in the Public Use and Possession Bill that the Council is voting on today documents that between January and July of this year, there were 11 overdose responses on average each and every day in a public place. We hope that by adding an enforcement tool that successfully prioritizes diversion over arrest, we hope that it will help people. We must increase the number of places for people to go. If you have someone that you care about and you love who's an addict, what you care about most and first is that they do not die in the throes of their addiction. By investing in Health One, Treatment in Motion, and a post-overdose recovery center, we are expanding access and breaking down barriers to proven treatment for our most vulnerable residents. We cannot end the fentanyl epidemic and drug overdose crisis without treatment, and we need more treatment options, not fewer. There's so much more work for us to do. I'd like to introduce Fire Chief Scoggins to the dais. I've really had a great pleasure working with him over the last 4 years, and he is really a driver in elevating Seattle's reputation as an emergency responder.
Good morning. My name is Harrell Scoggins, Fire Chief of the Seattle Fire Department. I want to lead with a thank you to Mayor Harrell and Councilmember Harrell for your ongoing support of the Seattle Fire Department. You know, it's really important to note that this isn't just the fire department, it's Seattle Fire Department, Human Services Department, and so many other community partnerships. We're living Mayor Harrell's One Seattle vision in the work that we do every single day. Our pilot began on July 7th of this year. We have continued to see a steady increase of Seattle firefighter EMTs, paramedics, responding to suspected overdoses in the city. Current Seattle Fire overdose data reads like this. We're going on about 15 a day, a little bit over 15 overdoses a day. Now, to put that in perspective, so far this year, we have responded to over 4,000 overdoses of all kind. And once again, to ground you a little bit more, all of 22, we responded to just over 3,700. So we're in September, mid-September, we're over 4,000. And we've already exceeded 2022's number significantly. In 2021, we had about 1,700. So the problem is getting bigger, and it's important to deploy resources to help with that. Frontline Seattle firefighter EMTs or paramedics are dispatched initially to overdoses to provide emergency medical care. And the new post-overdose response team is added to these responses as available. The role of the post-overdose response team begins once the patient is awake. It's important to note. So the firefighter, EMTs, and medics have got there, they've done their thing, they've stabilized the patient, and now Health 99 is on the scene. The post-overdose response team is part of the fire department's mobile integrated health program and responds out as Health 99. And just to give you a little bit about our mobile integrated health team, you know, we all know we launched that program in 2019 with Health One. We have a vulnerable adult program. Our case managers do an amazing job responding to vulnerable adults. So this is another component of that team. But Health 99 is staffed with a firefighter EMT and a human services department case manager. And Riley is here today. Riley goes on most of these responses. The single unit typically operates Monday through Thursday from 9 a.m. to 7 p.m. Health 99 works with a wide array of service providers to connect individuals who have experienced an overdose with outpatient substance use services, primary care, homeless outreach services, and so much more. The pilot program focuses on Pioneer Square, Chinatown International District, Belltown, the Downtown Business District, and Capitol Hill. But the team has discretion to respond elsewhere in the city. Health 99 stats since becoming operational, they've responded to 68 overdoses. They've conducted 20 client outreach visits. That's after the overdose, during follow-up with the person who has had an overdose. From combined overdose responses and follow-up visits, the unit has provided services to a total of 52 individuals. Some of the clients served by Health 99 have been seen numerous times by the unit. That means the same person is overdosing over and over again, and the team is on scene, still doing the work, still trying to get them in the services. 77% of those served by Health 99 are male. The majority are also experiencing homelessness and have a mental health history, in addition to battling the addiction. The team averages 3 to 5 overdose responses per 10-hour shift. And as you can imagine, when they find someone that says yes, and they actually start getting them in the services, that is a very long response where they're providing the care and needed services to get them connected that you're going to hear a little bit later. With the success we have had thus far in the pilot, there are so many difficulties and barriers to this work. A sizable percentage of clients served by Health 99 can't and won't engage in services, but that doesn't mean we stop. Our team stays on it. Experiencing overdose or have a need to go to the hospital. Many of them are using meth at the same time, which makes this work much harder. So it could be fentanyl, it could be meth, it could be opioids, a combination thereof, and it makes the work much more complicated. There are also challenges with finding clients after the first contact, since so many are unhoused. And this is where our Health One program comes into play. They help with that. We work really hard to find the person after the overdose. Additionally, finding destinations for all hours, clinics, places to do buprenorphine induction, and shelters also prevents difficulties. So finding a place to take a person to get the needed care can be a challenge sometimes. Success for this unit so far includes connecting clients with resources, but it also encompasses harm reduction or even having a conversation with individuals after the overdose. And sometimes that means Health 99 is doing a leave behind with Narcan or naloxone, just as our Health 1 units are doing also. So if they haven't said yes, let us give you this in case it happens again. Since this is a pilot, much of our work to date has revolved around establishing partnerships and learning about characteristics of overdose and overdose reversals. It's important that we understand what that is. Because we have personnel who are on the front lines, we think the fire department is well equipped to be a part of the multi-system response to this drug epidemic we are facing. Next, I'd like to introduce Seattle Fire's Mobile Integrated Health Program, John Ehrenfeld, who does much of the critical thinking with his team on how we respond to overdoses. And it's important to note that members of his team came up with the idea and concept of actually putting Health 99 on the street. So now I'll turn it over to John.
Good morning. My name is John Ehrenfeld. I'm the program manager for Mobile Integrated Health here at Fire, and I'm going to try to be brief. And thank you, of course, to Mayor Harrell, Councilmember Herbold, and Chief Scoggins. We founded Health One about 4 years ago. Our hypothesis was that the fire department was uniquely positioned to identify and locate people in crisis without adequate social or medical supports and connect them with resources. We believe that the fire department, with its rapid response, adaptability, and deep trust in the community, could reach out to people who were falling through every other gap in the system. We believe that we have validated that model in the last 4 years. Now we are testing a similar hypothesis around the opioid and fentanyl crisis. Drawing on models from around the country, we see an opportunity for the fire department, partnering with the Human Services Department, to reach people who might otherwise be unreachable and intervene swiftly after they have overdosed. And we have certainly encountered success so far in this. And it is by no means the majority of our clients, but we have found clients who have overdosed on the street or in their residence, connected with them, had a trauma-informed conversation with them, and obtained their consent to bring them to an alternative non-emergency department-based clinical setting, such as a buprenorphine clinic. Again, not the majority of the overdoses, but we have validated the model, showing that this is, in some circumstances, a possible alternative for these clients. The scholarly literature shows unambiguously that surviving an overdose dramatically raises your likelihood of death within the next year, so this population is particularly vulnerable and particularly in need of support. The literature also shows that connections with medications for opioid use disorder prescribers offers the best chance for recovery, but this connection cannot happen in a vacuum. Just as our Health One teams work with a huge ecosystem of services to address behavioral health, homelessness, and poverty, we will need to do the same with the opioid crisis. We acknowledge that we are not dealing with a single crisis, but rather a set of overlapping needs, including homelessness, mental health care, polysubstance use, lack of housing and shelter options, and more. We are committed to thinking deeply about how this team can be part of a supportive ecosystem and refining our approach, led by data and evidence, to best use our unique skills and access to reduce morbidity and mortality from overdoses and connect our clients with the supports that they need. And so to talk a little bit more about the wider ecosystem that we work in, I'd like to introduce my colleague, Dr. Kaylin Folkley from Harborview.
Thank you to the Health One team for inviting me to participate in today's discussion. My name is Kaylin Folkley, and I'm an emergency and addiction medicine physician at Harborview Medical Center. In the emergency room, we see firsthand the impact of the opioid overdose crisis. 5 years ago, I was working in the ER when I saw a young man who presented for an accidental heroin overdose. I discharged him with the available resources at the time, a take-home naloxone kit and a 1-800 number. A few hours later, I was called by the paramedics. They were performing CPR on a patient who had been found cold, pulseless, and surrounded by drug paraphernalia and hospital paperwork. They wanted permission to cease efforts. Before hanging up the phone, they identified the deceased, and the growing knot in my stomach tightened. It was the same patient I had just discharged. Research shows that an overdose survivor, like my patient, is more than 100 times more likely to die in the next year than the average person. This is comparable to the risk of death in the year after a severe heart attack. Think about all the things we do for patients who suffered a heart attack. They come in as a code to the emergency room. We rush them to the cath lab. They're hospitalized, started on medications, and discharged with close outpatient follow-up. What did I do for my patient? I gave him a naloxone kit and a turkey sandwich. We need to do better, especially since we have safe and effective medications to treat opioid use disorder, like buprenorphine and methadone. Fentanyl has also unfortunately changed the landscape. This year's number of overdose deaths associated with fentanyl has already surpassed last year's count. Because of the way fentanyl acts in the body, patients often have difficulty getting on these medications as an outpatient. However, the minutes after an overdose survivor receives naloxone could provide a critical time to initiate treatment with buprenorphine. Not everyone will want medications to treat opioid use disorder, but everyone should have access to them, especially immediately after overdose when patients are at the highest risk of death. Establishing the post-overdose response team is an incredibly important step to bring evidence-based interventions into the field where they can save lives. This team will provide a strong foundation to build on as we continue to reimagine our community's overdose response, providing people effective and compassionate care at the moment of crisis. Thank you.
Thank you, Dr. Folkley. At this point, I believe, before we take some questions, I want to thank all of you for being in this space. This is critical work we're doing for the city, and I want to thank you from the bottom of my heart. And with that, we'll take some questions, please, and I'll just call on. Go ahead, sir.
Sure. Thank you for the question. The way I understood it is that it reflected an increase in calls. We are seeing an increase in calls. Last year, the Seattle Fire Department ran over 106,000 emergencies. This year, we're tracking about 4 or 5% higher, but our overdose responses are actually tracking higher too. So I don't know if there's a direct correlation, but we're seeing an increase in both in the department.
Thank you, Chief. Yes, sir.
Today you mentioned that the council's going to vote on a public drug response. Do you feel that the delay in this has affected your efforts negatively? Do you feel this is a missing piece of the fight?
Whether the legislation is a missing piece, just to understand. Well, I have an appreciation for what the council's doing. This is significant legislation, and whether the delay has hurt us or help us at this point, I can't concentrate on that, and I'm hopeful that we'll have some good legislation passed out of the council today, and and assuming that it's passed, I'm not going to waste a lot of time on signing it, quite candidly, and hopefully we'll have our
Mic check. 1 2 1 2 1 2.
continuum of services
Mic
and
check.
how we approach the fentanyl crisis ready to rock and roll. And Councilmember Harrell, if you want to add anything to that, feel free to. So they have an important decision to make. We're optimistic based on this mini discussion, and I welcome that discussion. And hopefully we'll be ready to help people who urgently need help in this city.
Mayor, do you still plan to sign an executive order in enforcement of that piece?
Yes, I plan on signing an executive order, and we are monitoring all the conversations on the council, listening to communities, impacted communities, health providers, and our executive order. I'm looking at my director of communications, and if he goes like this, that means I'm not supposed to talk about when we're going to release that. But in all seriousness, we're after our discussion, after the council discussion today. We'll be ready to release it in a short time.
What will that look like, Mayor? What will the executive order look like?
I'm sorry, I couldn't hear you.
What will the executive order look like?
What will the executive order look like? A few things. Number one is, as I've said repeatedly, what our police department are really looking for is clarity when they see certain activities. And it hopefully helps them with this threat of harm standard, gives some clarity on at least what the executive's branch is thinking about. It also start off with a baseline approach on who's impacted, how many people are using drugs, impacting drugs? Where does this activity, where are we talking about what we see every single day? I think it's critical to have a baseline approach on data on what we're trying to accomplish. And then after that, we'll be able to look at the outcomes in 1 year. How many people were diverted? How many lives were saved? How many people were arrested with an arrest strategy? We'll open up the data for the entire city to see, but most importantly for the decision makers and electeds to see how well we are doing to help people. And so the executive order sort of outlines those parameters, and it'll be public here very shortly.
Mayor, do you believe there is harm from secondhand fentanyl smoke?
Do I think there's harm from secondhand fentanyl smoke? I don't know. I have a doctor here. How would you respond to that? How would you help the mayor out on one of these tough questions? I'll tell you, I don't want to be around it, but if you like, that's not your expertise.
Well, I was going to say, I don't think there's.
If I put you on the spot,
Well,
I'm a politician. I'm paid to do this.
Well, this whole thing is putting me on the spot, but I do feel like when we think about exposure out in the community, the only exposure we're seeing, when we know that fentanyl impacts people, is through direct inhalation and ingestion. So this kind of contact to fentanyl puts people at very low risk. I don't know if that answers your question.
I know bus drivers in particular said that they feel that they're harmed by that secondhand smoke.
I'll answer your question directly. I want to have a little medical expertise. I'll just speak from a personal example. I don't want to be around it. I haven't heard of anyone that's not using it that wants to be around it. So just as though there was a smoking ban in our state, I think that we have to be really, really concerned about, particularly in transit, in a bus station around a transit area where people have a right to be, who wants to be around exposed to toxic chemicals. And so I think that's almost common sense. And I just want to hear a little medical perspective on that. Yes. Yes. Oh, yes. Chris jumped ahead about 3 times, so I'm back to you.
Chief Scoggins, the doing the stand-up thing about Health 99 is kind of limited hours of the operates. Is that related to when service providers are operating, or what would the expansion of this look like?
Sure, the question was around Health 99's hours of operations. And you're correct. That is a direct relationship when there are service providers available. If there were service providers available 7 days a week, all around the clock, I would be going to the mayor and Councilmember Harrell and communicating that. But the reality is, that's not the case. So the team works in a time frame when they can take someone somewhere to get some help. And that's important to know.
Chief, while you're still there, you mentioned some of the challenges of reconnecting with patients after that first contact. What's your team doing are you just driving around looking for them?
Well, it's a lot bigger than that. The team does drive around and try to find them in their last known location or where they say they may be. But our other Health One units can help with that too. Our other firefighters around the city can help with that. So we generally deploy all the resources we can to find the person. John and his team does an excellent job in trying to relocate. But if a person is unhoused and they move their tent from one block to the next, it's hard to find them. But they know who they're looking for, and oftentimes they do find them, but sometimes they don't.
And someone who wants treatment, you said that there can be challenges finding a place to bring them. What is the timeline typically for someone who's actually ready to quit?
If we're on duty between 9 a.m. and 7 p.m. and someone says they want treatment, the Health 99 team will literally put them in the vehicle and take them to a location so we can start that location. We have a partnership with the clinic in Belltown that's been helping us out on that front, so that's been good. Just like our Health One units. If someone says that, hey, I don't want to be on the street anymore and they need a lift to a shelter, our Health One team will put them in the vehicle and go find a location to take them to. So we deploy all of those resources we can to find whatever help is needed for the person that needs it.
How do you actually measure success for the Health 99 team? Is it the number of cases? Is it getting people off the streets and getting people actually seek treatment? How do you measure success? What's the scale?
Sure. I'll be a lot simpler than that. If we can get one person into treatment and change their life, I view this program as a success. Because if it was my family member and they made that significant change in their life, and they get healthy and they have a positive outlook on life, that's success. We've had more than one, but that's one of the ways we will measure success. We measure success by if someone says, you know what, I will accept that leave behind, or I will accept that education, or I will sit and talk with you a minute. Because what all those things are doing, it's building the relationship possibly for the next time it happens, and then they will be willing because there's trust and there's a relationship, and then maybe we may not get them in the service the first time, but maybe it's the second time. So all those are measurements of success. That's why we track all of those things.
Yes.
I was just going to ask, do you have a particular area where you are seeing that success? We know total overdose rates are higher this year than before, but is there a particular area where you're seeing that? You mentioned the clinic in Belltown, but is there a success story you can share?
No, we don't have a geographic boundary where we're seeing success, but as I mentioned, we're operating in Pioneer Square, Chinatown International District, downtown, Belltown, or any other place any of our fire units will call us to. But we do have some success stories. Maybe I'll ask John to come up and share a success story. John, you might come up and share a success story? Because we have them. They're real.
Yeah. So, we responded to an overdose out in the community. This gentleman was unconscious, unresponsive, quickly resuscitated by our EMS crews. Our Health One team came in very rapidly. We're able to quickly build rapport with him, which, is certainly does not always happen, but in this case he indicated that he was amenable to treatment. They phoned over to a clinic we're working with very closely right now at about King County Public Health. He agreed to go and take a ride up to the clinic. We were able to do a pass off to them. They get him started on some medication to control his nausea, because a lot of these folks are feeling extremely bad because they're in withdrawal and not after resuscitation. And so, subsequently, it gets much more complicated in terms of, are they able to start on medications? Are they able to establish a relationship? But just in that sort of very minimal case, it's a success because we showed, there is going to be a subset of folks who we can divert, again, away from either remaining in the community or going to an ER. We can divert them to a clinical setting. And so again, with the understanding that this is not going to be every encounter, it is a process.
But do you see the step one, like this is the triage, but do you see the step one in turning the corner and stopping this epidemic?
I think it's part of a wider ecosystem.
So given the data you have, what is the future of this pilot? Are you looking to have ongoing funding for it, or expanding hours, or?
As I said when this was announced several months back, once we conclude the pilot, we'll look at all the information and we'll present the information to the mayor and we'll go from there. But right now, we think it's positive. It's a part of our Health One overall program, and we think we are having some positive outcomes. So we'll present all that once we wrap.
We'll take two more questions. I guess three, so go ahead.
Can you expand a little bit on the outward piece of things? Do you have data on when overdoses are most likely to happen in the city, whether it's specific hours of the day, certain days of the week?
Do we have that on when overdoses are happening in the city?
Yeah, most
overdoses are happening in the city all around the clock. It could be 2 in the morning, 2 in the afternoon. We have crews that come on right on shift early in the morning. They're going out the door on an overdose. So it's happening all around the clock.
Is there any time of day or any day of the week where you see it increase at all?
We can probably run that data. I just don't have it right now. We have the data on where we're going and for what we're going, but I didn't run that before this.
Sarah Grace.
You mentioned presenting data in the pilot. What is the term of the pilot? And then are there any other geographical areas you're considering focusing on?
So our goal is to run the pilot for, I think what I said a few months ago, between 3 and 6 months. And the reason why I put that window on is we didn't know how many calls we would actually have. So we want to have a nice subset of information before we present that further. And right now we're concentrating in the areas I mentioned because that's where most of the overdoses are happening in the city. That's why in that core, in the downtown core, and all the areas I mentioned, that's why we're concentrating.
Mayor, a lot of this sounds like what might be part of the new drug possession, public drug use law. Is one dependent on the other? You talk about 27 million free in place to take people.
I'm sorry.
The question is, this sounds a lot like what's been discussed for weeks regarding the new drug possession and public drug use law. Is one dependent on the other? You mentioned the $27 million that would be used to create the aftercare for drug overdose victims.
I think the question is one method by which we address the fentanyl crisis dependent upon the other? And that's a good question. So I look at it sort of in three phases. One is all the work we're doing, even in the education department, even in the parks department, on the preventive work towards someone striving toward health, positive health. That's all of the preventive work. The second phase would be in the crisis mode, where a person is using and they're in crisis mode. And the third phase sort of being is after the crisis mode, how do we not only save that life, but make sure they're on an ongoing path to recovery. And so they are somewhat dependent on one another. The continuum of health that I've been talking about since I've been mayor. And right now, this critical piece is when someone's in the crisis mode, because it's so critical that we're there quickly and responding with best practices. And so we're sort of in that middle phase, getting to the third phase on sustainable, ongoing recovery. So they are somewhat dependent upon each other. You can't do too much preventative work. When I go to schools, as I often go to sometimes, I'll look at children and I'll ask the educators and academicians, well, where on their path might they go wrong? Where are we losing them? Because all of these people that are in these health crises, they were children once. They were playing on play fields once. And so the preventative work we do, I can't say enough about how we're trying to do on a very granular basis, looking at the safeguards in place to help everyone. But in the meantime, until we have all of that 5, 10, 15-year work figured out, we have to respond efficiently because we don't want to lose lives here in Seattle. So we're gonna have a tour of the Health 99 apparatus next, so you can really see what's going on here and how we're doing this great work. And I want to thank all of you for coming out for our press run this event. Thank you very much.
And if any of you would like to see the vehicle that we're driving, it's here to show you around and talk to you about the process.
Empathetic words of encouragement.
Yeah, it's pretty cool.
Oh, I'm sure. I get what they're saying about, trying to catch them at that moment where you get resuscitated and you're like, maybe there's a little